Thank you for attending this session today. This is an informational session on the administrative rules of Montana pertaining to public health matters in schools, specifically the lead testing of school water supply systems and the requirement that went into place on January 7th, 2020, along with the adoption of the larger package of school administrative rule updates that DPHHS adopted in January 2020. So these new administrative rules contain many different changes, but the lead testing requirement that went into place did require schools to test their water supply by December 31st of 2021, and that's collecting those first samples. So today we have Don Nelson, our state toxicologist for DPHHS, and Greg Montgomery from DEQ, and Greg will go into a little bit more detail about how to test, what all goes into that, just the lead testing in schools program over at DEQ, and Don will talk about some different some health concerns around lead, and then what we can do, how to protect ourselves, and just what the implications of these different testing numbers are. So I will just first, we're starting out here on this DPHHS website. I just wanted to point this out real quick as we get started. You can go to this website to find information on the larger package of school administrative rules, and you can find guidance around the lead testing in schools. And in many cases, we direct you over to our partners at DEQ and the website that they have available as well. But this page here, you can see the top of the screen, dphhs.mt.gov/school health/school rules. So this is a place to go where you can find all that, the rules themselves and those resources and technical assistance. So at this point, I will pass it over to Don Nelson. And Don, you can share your screen. I'll stop sharing. I think when that comes up.
Slides?
Yep, we can see it. So I'll let you go ahead and take over and we'll continue on. Thanks, Don.
Yeah, thanks, BJ. Hello, my name's Don Nelson. I'm the state toxicologist for the Department of Public Health and Human Services. I manage the state's environmental health education and assessment program. So our mission with the environmental health program, affectionately known as MEHIA, and our mission is to decrease or eliminate and prevent exposures to hazardous substances in the environment that threaten public health. And we do this through conducting site hazard assessments. We provide technical assistance and community outreach. We also create educational materials. We also implement a sustainable Choose Safe Places for early care and education program to ensure that children at these facilities are not exposed to hazardous substances. Our role in the Lead in Schools program, not only did we draft the rules and help work through them with DEQ, but we also now provide lead toxicology and exposure assessment expertise to local and state agencies, as well as to schools in the community. We provide outreach activities such as this one and education materials to schools and parents. So the purpose of my presentation today is to just provide an overview of lead exposure and toxicity as an introduction or backdrop for Greg's presentation, and to help listeners understand the importance of sampling for lead in school drinking water. So this graph shows a lot of information. There are two key takeaways, however. The first one is that lead was phased out of products through regulatory mechanisms beginning in the 1970s. This occurred many decades after officials recognized lead exposure was a serious public health issue that needed action. And I'm saying like 1930s, 1940s. In fact, even before then, lead was known to be a problem. Paint was banned in 1978, and in the late 1980s, lead was removed from gasoline and plumbing. It wasn't until 1991 that EPA established standards for drinking water called the Lead and Copper Rule, which many of you are familiar with. The second takeaway that I'd like you to focus on is the blue and red lines. They represent the levels of blood in children. And as you can see, there was a very high point in the 70s before lead was banned out of products, up to 95 micrograms of lead in per deciliter of blood. And it dropped all the way down to here, just a 10-fold decrease to current levels. And yet there's still nearly 500,000 children under 5 in the US that have blood levels that are of concern. And it could be even more. And this statistic does not include children over 5. So if we have all these bans and regulations in place, why is lead testing still such a big deal? Well, children can still be exposed to lead in a multitude of ways. One exposure potential is by drinking water that contains lead from old leaded plumbing materials or fixtures. Many schools in Montana are in older buildings that contain this type of plumbing. There are also many houses that contain leaded plumbing. There are other sources of lead exposure. And as you may know, Montana has a rich history of natural resource development that began in the 1860s that has left a legacy of smelting waste and tailings contaminated with lead, which has been transferred to soil, dust, and water. There are other hazardous waste sites across our state that may be contaminated with lead as well. And thousands of people live in relative close proximity to these sites. Leaded paint is also a huge potential for exposure. More than 50% of houses in Montana were built before 1980, with roughly a quarter built before 1960. Older housing stock likely contains lead-based paint. Remember, lead and paint wasn't banned in the US until 1978. So house paint, for example, made prior to 1950 often contained up to 50% lead by weight. So older paint, let me see if I can get my little laser here. This is lead-based paint starting to peel. There are not newer layers of paint over it, but in many cases you will see where new paint layers new paint has been put on to old paint. And it's, the lead paint is fine if it's under newer non-lead paint and it's not chipping and peeling. But once you start seeing this kind of peeling and deterioration in the paint, then lead dust can fall from it and get onto the floor and the house dust. And same thing on the outside, if an exterior, the exterior of the house is painted with lead-based paint, that lead dust can get into the soil. So another source are old toys, imported candy, and ammunition. So just consider that approximately 15% of Montana's children under 18 years old live in poverty. Poverty level and age of housing are predictors of elevated lead in blood. And this is just due to the increased likelihood of lead paint being present and home surfaces not being as well maintained. So we're going to switch from lead exposure to lead toxicity. So what happens when lead is in the body? Lead blocks, binds, and competes with essential minerals such as calcium, iron, and zinc during metabolism by replacing these ions in the body. This in turn disrupts nerve cell connections and changes the levels of neurotransmitters in the brain. It can suppress different components of the immune system, making children more susceptible to becoming sick. It replaces iron on red blood cells so that less oxygen is carried throughout the body. This binding also reduces the amount of lead that leaves the body. Lead has a long half-life, 20 to 30 years, and it can accumulate in bone, weakening bones and affecting the overall bone health. And as we get older, just like calcium is released and gets circulated, the lead that is in the bone can also be released into the blood and circulated. and cause health effects. So the amount of lead absorbed and circulated really depends on the source. So lead that is in soil, for example, is often bound to some extent to the minerals in the soil, depending on the soil type. So for example, lead from one Superfund site might absorb at a rate of 20%, while at another site it might be higher, like 70%. However, lead in water and paint are both highly absorbed because there's nothing for the lead to bind to. So these cellular events can result in damage to the brain and nervous system. It can slow growth and development. It can cause learning and behavior problems, as well as hearing and speech problems. Ultimately, this can lower the IQ, decrease ability to pay attention, and cause underperformance in school. Studies have shown that in kids that for every 10 micrograms of lead per deciliter of blood increase in the levels, IQ decreases 2 to 4 points. These health outcomes can be irreversible, especially if a child is chronically exposed and not treated. So many of the effects I just mentioned are due to lead in the brain, but it has been found that lead is toxic to pretty much every organ system in the body, no matter what the exposure route is. It easily moves through the body. On this graph, it shows just all the different systems that have been studied and where lead has been found to cause health effects. So just as a little side, these lead toxicity associations are also relevant to adults, although at much higher levels than children. But examples of health effects are hypertension, anemia, infertility, and decreased cognitive function. Pregnant women are considered a sensitive population too to the effects of lead. Women can have or experience gestational hypertension. Their babies can be born prematurely with low birth weight, and they can experience similar neurological damage as children who are exposed during early childhood. So children are very susceptible to the toxic effects of lead, especially compared to adults. And there's a threefold reason for this. They're highly exposed. Children play on the ground, they play on the floor, they get their hands dirty, they touch their food with dirty hands, they touch their toys, they put them in their mouths. Very young children might eat paint chips thinking there's something else that contain lead. And they also drink more fluids for their body weight compared to adults, including water. They have much higher absorption rates than adults, up to 5 times more. And that's because their GI tract is developing and their body needs to absorb nutrients at much higher rates to get enough nutrients. They're also highly susceptible. Children's bodies are still developing. Their metabolism, nervous system, and immune system are immature, and they're vulnerable to foreign substances. Children younger than 6 years old experience rapid growth, and anything interfering with this can cause a delay. Finally, lead can easily cross the blood-brain barrier by competing with calcium and other minerals in the transport receptors. So other factors that can affect the level of toxicity and health outcomes in an individual child include a child's age. Of course, the younger, the more vulnerable. Nutritional status, low intake of calcium and iron increases lead absorption. So children with inadequate nutrition on a daily basis are more vulnerable to the toxic effects of lead and have higher levels in their bodies. So supplements and a good diet help counteract the toxicity of lead. The source of lead exposure, as I had mentioned before, lead in water and paint is much more highly absorbed than lead in soil, and the amount of absorption in soil just depends on where it comes from and the type of minerals that are in the soil. The length of exposure time is also important. So a one-time exposure might not lead to any health outcome. A chronically exposed child, on a daily basis, will very likely have some kind of health effect. And then, of course, the presence of underlying health conditions can make someone more vulnerable. So the good news is that childhood lead poisoning is 100% preventable. However, as I mentioned before, lead still remains a serious threat to the health and well-being of children in Montana and across the U.S. Our current system is set up to be reactive rather than preventative. In other words, doctors screen kids for lead based on a risk assessment, but only at a parent's request or when there is a suspicion that a child might live around lead. Excuse me. Now, Medicaid requires lead testing at 1 and 2 years of age. However, health care providers do not always follow this requirement. So, if a child's been exposed, their lead could have already caused damage if it's not found quickly. So this is why we need to focus on primary prevention. Testing for lead in schools is a prevention approach so that we can find it in the environment and fix the problem before kids are exposed or before lead can affect their bodies if they have been exposed. It helps us to know which kids we should prioritize in terms of testing. If lead is detected in a child's environment, it does not necessarily mean that they're exposed or impacted. It really just depends on, again, the age, where the lead is located. If it's in if lead paint is in a basement bathroom that nobody uses and the door's closed, then the child's probably not going to have any lead in their blood unless they have other potential exposures. Lead exposure and poisoning frequently go unrecognized because it occurs without any obvious outward symptoms at first. So a child must be tested by a healthcare provider in order to diagnose lead poisoning. CDC currently uses 5 micrograms of lead per deciliter of blood to identify children with levels that are much higher than children in the general population and who need further evaluation. Based on a 2015-2016 National Health and Nutrition Examination Survey, or NHANES data, in children ages 1 to 5 years who are in the highest 2.5% of children when tested for lead in their blood. So according to this data, the average blood level in young children has fallen to below 1 microgram per deciliter. And this is what's considered background. So the 5 is based on those kids who are well above background. And frankly, lead is everywhere in the environment still, and it is really difficult to get to 0. CDC's reference value, just as a little backdrop or history, CDC's reference value is the latest in decades of successive reductions in this level, beginning at 80 to 100 micrograms per deciliter, to 40 to 25, down to 10, and right now it's at 5. There is talk that CDC will reduce this value again. And that's because researchers have not found a level without some adverse health effects. So even below 5 can cause subtle but potentially long-term effects. So to wrap it up, why is sampling for lead in school drinking water important? Well, children are highly susceptible. There's no known safe blood lead level. Lead in schools contributes to the body burden. Children spend a large amount of time at school. And there are lead plumbing fixtures in old buildings. Ultimately, it's vital to our quest to eliminate lead poisoning in children so that they can have a good start to healthy life. And it helps public health officials capture all the possible exposure pathways so that we can attain our goal of 0% childhood lead poisoning. That's the end, and here is my contact information if you have any questions. And thank you for watching.
Great, thank you, Tom. And I think what we'll do is, if you do have any questions that come in from anyone on the website, at any time that you view this, please send those to Dawn. Any questions you have for Greg or myself, and we'll get those back out to you. We will have a couple other resources that we're working on. DEQ has some frequently asked questions, and I believe we're working on something similar at DPHHS. So depending on when you watch this, we may have some material out there on the website related to frequently asked questions. So at this point, we'll turn it over to Greg, and he can go into more detail about the actual testing program and the requirements in the new administrative rule.
Thank you, BJ and Dawn. So again, my name is Greg Montgomery. I'm with Montana Department of Environmental Quality, and I'm the lead in school drinking water rule manager. So I oversee this program, the lead sampling program, on behalf of DPHHS. So here's just a quick agenda. We'll do a little intro, a little more specific specific information on sources of lead, it's specifically in drinking water. Go over the rule requirements, available funding, and resources as well. So BJ touched on this a little bit earlier, but again, this rule went into effect last January, and it applies to all schools accredited by the Montana Board of Public Education. And again, those schools are required to sample by the end of this year, so December 31st, 2021. So sources, so I just wanted to expand a little bit on what Dawn was just talking about in her presentation, but specifically about drinking water. So lead is primarily found in drinking water through corrosion of premise plumbing. So meaning the plumbing inside your school. And it can be found in a number of different types of plumbing materials. Solder used in copper pipe insulation historically has had high levels of lead. If there's lead pipes present, specifically if there is a lead service line which connects your the water main in the street to your school, those can be lead. Galvanized iron piping, brass fittings, and then especially older plumbing fixtures can have higher concentrations of lead in the materials themselves. Lead is also can be naturally occurring in groundwater and surface water, although we don't really typically see that in Montana. And then also, as Dawn mentioned before, it's also can be a contaminant, either from a Superfund site or some other spill or something like that. Can be found in drinking water and surface water. So this picture just kind of gives you a general idea how water enters a building or a school. So generally, as the water is entering from either if the school has a well or if it's coming from a municipal source, the water tends to be relatively cold. As it enters the building, that water generally gradually warms up. As the water gets warmer, it has potential becoming more corrosive, and that's when you'll see the lead will leach out from those potential fixtures that may have lead in them into the water stream. So you'll see it in fittings, in couplings in the piping and fittings, as well as in the fixture themselves. So as far as the requirements that are in the rule, schools are required to sample all of their drinking water fountains, and then all sinks used for food preparation, so all kitchen sinks that are either used for food preparation or drinking, and then any other potential, any other fixture that has the potential being used for drinking water or food prep. So that includes bathroom sinks, it includes classroom sinks, sinks in nurses' room, offices, concession stands, anywhere where children may have the potential of drinking the water from. And again, the schools have until the end of December of this year to complete this initial sampling round. Before the sampling can be conducted, there is some information that's required. An inventory of the school fixtures has to be completed. So we have templates on our website that'll go over and guidance documents on how to fill that basically spreadsheet out. So listing out all the fixtures that are in a particular building, where they're located, the type of fixture it is, the make and model if you know it, and maybe the age of when it was installed. Along with that inventory, there's also a plumbing information form or history form for the school. So it's just asking for general information about the school. What type of school is it? Is it an elementary, middle school, high school, K through 12? The number of children that attend that school, the year the school was built, and then just basic contact information, and then just general plumbing information if the school has it. So the type of plumbing, if you're aware of it, is it copper, is it galvanized, is it plastic, things like that. And then the third thing is also basically a simple floor plan or site plan, and that kind of goes along with the inventory. And most schools so far have been using their evacuation maps, and it's not meant to be complicated, but simply, taking that evacuation map, putting in the locations of where your fixtures are. So when a couple years from now, or when staff changes, you'll be able to find these fixtures and where they were sampled. And again, we have guidance documents that help you go through that process. And then the fourth thing that is required is the flushing plan. And I'll go into a little bit more about that next upcoming slides. But anytime the school is inactive for greater than 3 days, the water is required to be flushed out of the system. So meaning you're just trying to get that stagnant water that's been sitting in the system that could be accumulating higher concentration of lead. You're flushing that water out. That flushing plan is due on September 1st of 2021. And other requirements, so once you do get the results back, based on the results of your sampling, there will be follow-up actions required, and I'll get into that in the next slide. And then once the follow-up actions have been completed, there is long-term routine monitoring required as well. So once you get your results back, the data is kind of split into kind of 3 bins or categories. So if the results are less than 5 parts per billion, no action is required, and then kind of move along to the routine sampling. If it's between 5 and 15 parts per billion, a remedial action is required. So you have to evaluate that particular fixture and kind of determine what the next step would be. And again, we have documents to help you through that process, as well as I'm available to help schools with that as well. So that remedial action could be simply taking that particular fixture out of service. So if it's a sink that's no longer used, easiest way is just disconnecting it. It could be replacing the fixture. If it looks like it may not be the fixture, but that's the source of lead, it could be the plumbing behind it. That potentially could be a more extensive plumbing replacement. You can also use auto flushers, which are devices that automatically flush the water in that particular fixture on any given period of time and duration. And you can also use point of use filters. So little carbon filters that go on the that particular fixture to remove the lead. Any concentrations greater than 15 parts per billion would have the same requirements with, but also including if it's over 15, fixture does have to be immediately taken out of use. If it's between 5 and 15, you can keep that fixture in service or in use as long as a interim flushing plan is developed. So meeting might be flushed every morning to make sure that stagnant water gets out of the system. And then following the remediation action, so if you do replace the fixture with a brand new one, there are follow-up samples required just to make sure that whatever was selected was effective and the lead has been reduced in that particular fixture. So there's a follow-up sample required immediately after the remediation and then also 1 year following. And then the sample results are also required to be made public. So we do have and I'll show what that looks like in a few slides, but we do have a dashboard on our website that shows that provides that information to the public. So once you do go through that routine sampling, once you do get through the remediation and follow-up sampling, the school would go to a routine sampling, which is typically going to be every 3 years. A school can apply for an alternative schedule up to 5 years, and that's really depending on the inventory that was done, like what the fixtures are made out of, what the plumbing is in the building, as well as what the results were of the initial sampling. So there are a number of schools, about 95 schools in Montana that are kind of standalone public water supplies. So meaning they have their own wells and they're above a certain population. Those particular schools currently sample for lead under the federal lead and copper rule. However, the Montana requirement and the federal lead and copper rule are two separate requirements, and unfortunately the data is not interchangeable. So the schools that are public water systems would still have to comply with the Montana requirement as well. So they'd have to do two separate samplings for lead. So this is the dashboard that I just mentioned, and there's a link to this dashboard on our the DEQ website. And this basically has a summary of the program, just general information about the rule itself, and then as well as you can click on this button and it'll take you to a dashboard showing a table, and here you can actually select the individual school that you want to see the results for. And the table will indicate by using the stoplight format. Green is less than 5 parts per billion, yellow is 5 to 15, and then red would be greater than 15. And then you'd also have the ability to download the data by clicking the download, and it'll export that into an Excel file. As well as my contact information is on this as well. We're going to continue to kind of expand this dashboard, especially for schools, so you'll be able to access your inventory, your schedules when you have to sample. There's also be a table showing when remediation, what fixtures were needed to be remediated and what was done to remediate them. So this is just a general flow diagram we had put together. And again, this is also available on our website. And it just kind of, we broke it up into a number of steps to try to simplify each step going through the program. So the first step, again, is that setup process, which includes the plumbing information, the inventory, the site plan, the flushing plan. There's also a communication plan that is not required, but we do recommend it, and we do have template and guidance documents on how to put that together if you choose to do so. Following step 1, that's when you move into step 2, which actually be selecting your laboratory. And we have a list of laboratories you can pick from, as long as it's certified in the state of Montana. You can use that particular laboratory. You work with a lab, and they'll send you the appropriate bottles, and then proceed with the sample, actually collecting the samples and then shipping the samples back to the laboratory. Step 3 is understanding your results. So when you get that results back from the lab, what does that say? What does that kind of tell you? And then what bins or categories do those results fall into? And then also how to remediate and getting through the follow-up sampling, and then finally moving on to routine sampling. So this is just a general kind of overview of the actual how to collect the samples themselves. They're pretty straightforward. You don't need any certification or have to be an operator in order to do the sampling. The samples used are a small 250 ml plastic bottle, which the lab will send those to you. The samples have to be what we call as a first draw. So the samples have to be collected typically in the morning when the water's been sitting in the pipes between 6 to 18 hours. And that's typically early mornings, best time to collect the samples. The reason for that is you're trying to capture kind of like that worst case scenario of a typical day, what a child would be drinking from that water fountain first thing in the morning. So you simply just, and first draw is you want to make sure that you collect that sample the very first, the water that comes out of the tap. Basically just fill that the bottle up, you close the cap and then label it, and then that gets sent back to the lab. So these are just some simple things that you can do to reduce lead in the drinking water. Advising staff and students just to run the water for a few seconds before drinking. So that could be if the classrooms have individual sinks and drinking water fountains, or drinking water fountains in the hallway. Simply just running it a little bit before you take that sip kind of eliminates any of that stagnant water that could be in the system. Also removing or replacing any of the older fixtures in your facility that could contain higher percentages of lead. Another big one is getting kind of routine maintenance and cleaning and replacing the fixture aerators. So the aerators, which are kind of screw on the end of the faucets, they can accumulate little bits of things that have fallen out of the piping system and kind of particulate lead. So it can cause higher concentrations. So it's important making sure those are cleaned and replaced on a regular basis. Again, one of the most effective things is flushing the system, and we'll get more into that in a second. Another one is only using the cold water tap for drinking and food preparation. As I mentioned before, warm water, hot water can be more corrosive, so you can have the potential of getting higher lead concentrations. So making sure that you only use the cold water side when drinking or preparing food. And then again, you can always install water treatment devices. So that could be on the fixture itself. It could be a whole school treatment system as well. And the final option is providing bottled water. So the flushing program, again, this is required anytime the school is inactive for greater than 3 days. So primarily like the summer break, winter break, or any other time where the school is kind of empty for 4 days or more. And that the plan itself is required to be submitted by September 1st of this year. And again, the main reason for that is stagnant water can accumulate higher concentrations of lead. So one of the most effective ways of controlling lead is simply making sure that stagnant water is routinely flushed out of the system. So flushing, basically the flushing program, all that really means is you're opening the taps and letting that water run out. Kind of one of the easiest ways to determine how long you let it run for is you wait for that water temperature to change. So typically, the longer you run the water, the cooler that water should get as it starts pulling water from outside of your building. So for the flushing, you generally want to start from the fixture farthest away from your service connection. So where the water enters the school, either from the water main in the street, or if you have a well, you want to find the fixture farthest away. And that can be any kind of fixture. It doesn't necessarily have to be one meant for drinking. It could be a janitor sink. It could be an outside hose spigot. Those things, and you want to make sure you run that fixture the longest. And you're trying to kind of empty the water that's sitting in this main plumbing header that goes through the building. And then once you kind of feel, you can either calculate based on length of piping and type of piping, how long you have to run it for, or once you feel that water change, or if you have a given time period, you kind of work your way back. And as you go to each particular fixture, as you work your way back, because you've already drained that main line, you shouldn't have to flush it that long before that water starts. You'll be able to feel the difference. So that might only be running the water fountain for 10, 20, 30 seconds before you start getting colder water coming in. And then you know the water's been flushed. And we do have a template to put the flushing plan together, as well as a guidance document to help you through that on our website. So another routine maintenance that I mentioned before is just making sure you inspect, clean, replace faucet aerators on a regular basis, especially if any recent plumbing work or construction's been done. So if any kind of, the pipes got knocked around a little bit, or there's construction on the building that might have caused vibrations, that tends to knock stuff loose that's been kind of caked on the inside of the piping, and that can get stuck in your aerator, and it can also cause potential higher concentrations of lead. So again, you want to make sure those are inspected and cleaned on a regular basis. You also want to make sure that when you're flushing your water system, that you do remove the aerators while you flush, especially when you're flushing it. That water's coming out at a higher velocity, and it can also knock stuff loose. So you want to make sure that you remove the aerators for that, and then make sure you put them back on once flushing is completed. So available funding. So DEQ does have a grant from the EPA that will cover all of the laboratory analysis for your initial sampling round. So the way it'll work, and it's not anything you have to apply for, the way it works is as long as you select one of the approved laboratories that can run lead in Montana, you'll send your samples to the lab, they'll do their analysis, and they'll send the invoice directly to DEQ, and then we'll pay that. That grant can only be used for public schools. Unfortunately, it can't be used for private schools. And then the grant covers just the initial round of sampling at this time. And that may change as additional funding becomes available. So other funding sources, especially for remediation, DEQ is working with OPI on a remediation reimbursement program. So we do have a small kind of reimbursement program that schools can apply for to seek reimbursement up to $1,000 per school for remediation costs. That plan is managed through OPI. So once you do get your results back, and if you do have exceedances, I essentially notify OPI, and they automatically send you an email with the application process. Unfortunately, that we do have limited funding for that grant, so it is first come, first serve. There are a number of other potential funding sources for schools, which are a mix of loans and grants, and it really depends on the school whether they qualify for the different types of loans or not, or grants. But I do have information on this on our website as well. And the ARPA and CARES funding does cover bottle fill stations as well as motion activated fixtures because they reduce the risk of transmission of the COVID virus. So those can be covered under ARPA as well. And because they're newer fixtures, they tend to have filters built in. There's a beneficial use of, you get a lead reduction as well. So other resources available to schools, we do have our website, as well as that sample dashboard that shows the results. Our website will have all the guidance documents. There's frequently asked questions, all the templates and forms, and the different links are on the website. DEQ is also available to provide assistance and to help schools if they have questions, they can call. And we're also working very closely with Department of Public Health and Human Services and county sanitarians, as well as state toxicologist, which is Dawn, as well as OPI, especially on the grant program for the remediation reimbursement program. We also have 2 technical assistance providers that can help schools, at least through the initial setup process. So getting your inventories together, even training you how to sample, basically up to the sampling part. And that's through Midwest Assistance Program or Montana Rural Water. And if you do need assistance from them, please contact me and I can put you in touch with them. Another potential good resource is your local water department. A lot of the water departments, I mean, they take lead samples all the time, and they're familiar with how to deal with labs and how to take samples, and they can be a good resource to schools that aren't familiar with how to collect those samples. So that's all I had for this presentation. Again, if you have any questions or comments, please give me a call.
Great, thank you, Greg. And I think the only thing that stood out to me just towards the end of your presentation that I would maybe add on at the end here is that private schools that are accredited by the Board of Public Education are required to meet the requirements of this rule and all the school administrative rules adopted by DPHHS. But I think that's the only other comment I had there towards the end. Perfect.
Okay.
Great. Well, thank you, Don, and thank you, Greg. We will go ahead and wrap this session here, and we'll get this up on the website, on both websites here in the coming weeks. So thank you both.